And Chairman Day, Chairman Samuelson, members of the House Aging Committee, good morning, and thank you for the opportunity to participate in today's hearing. I'm Zach Shamberg. I am the President and CEO of the Pennsylvania Healthcare Association. As you probably know, we represent long-term care in Pennsylvania. That's nursing homes, personal care homes, and assisted living communities. We represent the providers, the vulnerable residents they serve, and especially for the purposes of this hearing, the workers, our healthcare heroes. What's interesting is that back on December 1st of last year, we testified on this exact issue before the House Republican Policy Committee. And prior to that, in spring of 2021, we testified before members of the Senate on this exact issue. And what's troubling about that is that the workforce shortage in long-term care has not improved in that time. In fact, that shortage is now a full-blown crisis. And it's having a direct impact on access to care throughout the state. Just last month, we surveyed our PHCA members to better understand this issue and how it's impacting the care that they provide. We knew there was a problem when hospitals across the state reached capacity back in January and February during the surge in COVID-19 Omicron cases. One of the primary causes of that capacity issue was that hospitals could not discharge their residents to long-term care facilities. And you might ask why. That's because long-term care facilities didn't have enough staff to care for new residents. It's really that simple. Last month's survey, which was actually handed out to members of this committee today, took a statewide snapshot of our sector from December 2021 through last month. And here are some of the troubling top-line results. 60% of our members revealed that they declined referrals as a result of short staffing. On average, each of those facilities turned away 20 potential residents per month. That's 20 vulnerable senior citizens who were turned away from receiving care. The average nursing home wait list, yes, wait list, a word I never thought I'd have to use when talking about nursing homes, has 8 people or more on it currently. And 20% of our members said new admissions are now traveling further than ever just to find care. Here's what's most alarming. Nearly half of our respondents said they have, on average, more than 30 empty beds in their facilities, just sitting there because they don't have enough workers to staff them. So there are seniors and there are adults with disabilities who can't access care in one of the oldest states in terms of population in the entire country, simply because we don't have enough staff. So how do we fix this? First, we are advocating for a meaningful investment in Medicaid reimbursement for nursing homes in this year's budget. That investment would empower our providers to pay higher wages, recruit more workers to the front lines, and meet the demands of rising operational costs. Second, American Rescue Plan, or ARP funds, can be utilized for recruitment and retention bonuses for our sector, just as this committee and legislature did for Pennsylvania's hospitals earlier this year. Third, Chase mentioned the challenges related to staffing agencies. Representative Tim Bonner, your colleague, has introduced legislation, House Bill 2293, that would both establish oversight over staffing agencies, and it would prevent Medicaid funding or taxpayer dollars from being siphoned away from resident care to pad the pockets of staffing agency executives. And that bill is awaiting action in the House Health Committee now. And finally, we need your help to ensure that state contractors are meeting their goals, especially when it comes to building our workforce pipeline. And let me explain. In 2020, members of this committee supported legislation to allow temporary nurse aides, or TNAs, to become full-time CNAs in nursing homes so they could continue to work after the federal disaster declaration ended. I'm proud to report that more than 5,000 Pennsylvanians have signed up to become TNAs already. But to become a CNA and take that extra step, that requires a certification process. The state has entered into an agreement with Credentia, a company that has been tasked with testing and certifying those 5,000 workers. The problem is that since the beginning of that contract, this process has been a total and complete disaster. There are very few testing sites, even fewer instructors, and you've got a better chance of getting the President of the United States on the phone than one of their service representatives. That is, unless you choose to wait 2 to 3 hours on hold. Time and time again, our members are telling us that their TNAs are just giving up on the process. They would rather leave the field and go to another job in another industry than try to work against the barriers and the burdens that our state government has created. I bring that up because there is a reason that this body and this committee continues to extend healthcare waivers from the pandemic, because you know we cannot allow bureaucratic obstacles to stand in the way of delivering health care. Credentia and this process for our members is the definition of a bureaucratic obstacle, and it has to be fixed, or we will lose 5,000 workers who must leave the front lines. It is not too late to put us on a path to solving the workforce crisis, but it is a crisis. And I want to illustrate the reality of what we're facing and what it could mean across the state. 2 weeks ago, I stood outside of a nursing facility in Warrington, Bucks County, that specializes in ventilator care. And your colleague, Representative Todd Polinchuk, stood there with me. We were there to announce that that facility would be closing. The provider, Fox Subacute, was forced to make that difficult decision to close its doors because costs have continued to rise, especially throughout the pandemic, but Medicaid reimbursement hasn't kept up. 46 residents on vents will now have to be transferred to different facilities, but there's a problem because there are no available beds in this state for those residents. Unless we address real investment in long-term care and get serious about fixing our workforce crisis, I am certain we're going to be making more and more of those announcements throughout the state. Thank you very much.